everyone, I'm Denise Pattison. I am your instructor for your class, Nursing Informatics. I have probably had some of you in class before, and for those of you, welcome. So we are going to start discussing Chapter 1 of Nursing Informatics and kind of understanding what is Nursing Informatics. And it's really funny. When I went to nursing school, we didn't have this class, and that was only about 13 when I started about 13 years ago. So when I went to graduate school, they had this, and then when I started teaching, and they said, Denise, will you teach nursing informatics? I was like, sure. First, let me learn what nursing informatics means. But it's actually really interesting, and very simple explanation is nursing informatics is literally how we exchange information in healthcare, specifically in the nursing field. It's very easy when you just break it down to that. Now, of course, it builds into more complex ideas when you're talking about how we exchange information. But nursing informatics captures a lot of things that you don't realize, anywhere from charting your vitals, communicating with another interdisciplinary collaborator, social media and health tips, how we distribute appointments to patients, anything that has to do with the exchange of information, whether it's technological or not, is nursing informatics. So that's something just to remember when you start to get overwhelmed with the idea of nursing informatics. So the objectives for this class, the first is we're going to define nursing science and its relationships to various nursing roles in nursing informatics. So how does the science of nursing, the approach of the nursing foundation, affect the way we share information and its relationship to our roles in nursing? So, when people say, what's the difference between a nurse and a doctor? I mean, obviously, there's lots of differences, but basically it's the way we're trained, right? We look at the environment, we look at the patient, and the actual human science behind issues to talk about how we approach a treatment plan. And that is the pure basis of nursing science. And so when we talk about nursing informatics, we're going to look at it from that nursing standpoint. So it is different from health informatics in the sense that we are going to be putting our own spin to it with that whole nursing background. So we're going to introduce the Foundation of Knowledge model, circa 2007, as the organizing conceptual framework for the book. So we'll talk about the knowledge model together. And then explain the relationship between knowledge acquisition, knowledge processing, knowledge generation, knowledge dissemination, and wisdom, which is part of the Foundation of Knowledge model. Okay, and that's just kind of how the idea of when we get new information, how we process it, and then later share information. So the building blocks of informatics includes nursing science, information science, computer science, and cognitive science. When we talk about nursing science, again, what I was talking about before, which is our building blocks as nurses, right? Looking at the environmental milieu, nursing theory, where we came from, and then, of course, information science. So that has to do with how we exchange information, what type of setting you have to be in order to absorb it, what type of setting you have to be in order to give it, how information is absorbed and how it's misconstrued, and then how it's utilized and disseminated further. Computer science, pretty obvious, right? We're going to talk about all that software stuff and how to use the computer and how it pertains to informatics. And then cognitive science is really important. How people process information, how you process information is going to affect the way that you're going to present information. So a thought-provoking question. Imagine you are in a social situation and someone asks you, what does a nurse do? Think about how you'll capture and convey the richness that is nursing science in your answer. So really quick, I don't want you guys to panic on this. And maybe some of you can answer better than I. I've been now in nursing, if you include nursing school, which I'm going to because nursing school is horrendous. 13 years, which isn't that long compared to other people. And sometimes I have a really hard time capturing the essence of what makes us nurses. What is it about nursing science? It's really hard to put into words, right? Because we're not just ooey gooey, touchy-feely, holistic approach, which I love. I mean, that's what makes us great nurses. But we also have real hard evidentiary science into our everyday practice. But I think what makes us amazing people in terms of what makes a nurse is that we can combine it all into this really cool type of practice that makes the whole person and family better. So that's a thought-provoking question. What does a nurse do? How do you capture that essence when you explain nursing science? So let's talk about the ANA definition of nursing. Nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and populations. So let's break this down real quick. So nursing is the protection, promotion, and optimization of health and abilities. Okay, so we're not saying here nursing is the treatment of disease, right? We protect, promote, and optimize health. What does health mean? Well, health can mean a lot of things to different people. It could say my ability for me to go to work and provide for my family. My husband might say my ability to get up every day and take care of my children and support my wife in the best way possible. Some of you might say health to me is being able to control my blood sugar and be healthy enough to go to work. And you might say, okay, well, Denise, that's actually abilities. So what do you mean by health? Well, we sometimes use them interchangeably in nursing. We see that people's health ties into their ability, their chance to contribute and their chance to live in the best way possible. So we want to protect whatever baseline health there is. Promote, which is prevent and save the future of somebody's health. And optimize, okay, somebody's sick, right? Well, how can we make their body at their baseline work the best way possible so that they can achieve the abilities that they need to achieve to have a good quality of life? Prevention of illness and injury, that's pretty obvious, right? Prevention of illness and injury. Let's immunize people to protect them from injury. Let's teach parents to put their kids in car seats so we can prevent infant mortality and toddler mortality with motor vehicle accidents, which used to be the #1 cause of death. Alleviation of suffering through the diagnosis and treatment of the human response. So you know nursing diagnoses. You don't diagnose medical diagnoses as nurses. Maybe as nurse practitioners you do, but again, you do it from the approach of the human response. So when we talk about somebody is under weight, we say deficient in nutrition with low calorie intake, right? We don't say that somebody is malnourished. We use it from that approach, the human response approach. And our job is to alleviate suffering looking from that human response approach. And then advocacy in the care of individuals, families, communities, and populations. As nurses, we are advocates. That's what makes us nurses. We are here to defend the individual, the family, the community, the population. We look at what the individual's whole need is and the family's whole need, because that in turn is going to affect the individual, and the community's whole need, because that in turn is going to protect the family and promote the family. And populations is going to show us what communities need our help. So the definition of nursing is a very complex definition. It's very rich and full of different meaning, and it can mean one thing to you and one thing to another person, but in the end, all together, nurses, we protect, we promote, and we optimize. We look at the whole person, and that's what makes us these unique caregivers. I think sometimes it's really easy for us to just say, well, we're compassionate. Great, that's fine. I'm glad you're compassionate. You know, also compassionate candy stripers and volunteers. But we're not just compassionate. We are compassionate scientists who are willing to look outside the box.